Hi there, I'm Bree Wright, and I'm here to show you how to use Onyfix, a brand new revolutionary nail correction system. This technology is pain-free, non-surgical, non-invasive. It's an evidence-based medical device that is suitable for the treatment of involuted nails on even your most high-risk patients. Anyone watching this has already seen the webinar and learned the theory behind Onyfix. I'm here today to show you how to apply it in a clinical setting. So before we get started, I think it's really important to quickly review the 6 steps in applying the Onyfix, just because it's very easy to do, but if you miss a step, you can run into trouble. So step 1, you want to prepare the nail, and that means using a burr, a diamond burr if you remember from the workshop, to roughen the surface of the nail that you wish to correct. And this is going to allow the primer to create a really good grip. Step 2 is very simple, degreasing the nail with rubbing alcohol. Well, we just debrided the nail. There's going to be some dust and debris. Let's wipe that off and start from a clean slate. Step 3, applying the Onyfix primer. You take 1 drop of the Onyfix primer. Remember, too much is not going to dry properly and it's going to affect the adherence of the Onyfix. So 1 drop in your lid, use a cotton bud and spread it evenly and thinly over the entire nail. Step 4, we need to cure that primer or dry it with our LED light. You do that for 30 seconds. And this is just a reminder that LED light is a blue ray and it is not harmful. You and your patients are not going to need to wear glasses for that. It's bright, you want to cover it, but you're not going to need to wear glasses. Step 5 is when you place the Onyfix. Now, whether you're using the hard composite or the soft, you just want to make sure you're applying it as close to the matrix as possible without touching the skin. And you're going to want to make sure that it's 2 millimeters high and 2 millimeters wide. You have as much time as you need to apply the Onyfix. It's once you dry it, it's set. You can always then use your ceramic burr to shape it properly, but it's really best to play with it as long as you need to get the exact shape that you want. Now, if you forget how big 2 millimeters high or 2 millimeters wide is, you take that nice little Q-tip, and the body of your Q-tip is almost exactly 2 millimeters wide and high. And so I really like to, just before I dry it, it's perfectly in place, hold my Q-tip there and make sure that it looks just the right size. You're then going to take your LED light again, and whether you're using the soft or the hard composite, you're going to dry or cure the composite for 60 seconds. Again, once that's done, take your ceramic burr, file it out, give it a nice, smooth, professional finish. It's really important that you do not use a diamond burr to do this. The diamond burr, the resin gets stuck in the diamond burr, and the diamond burr is no longer able to be sterilized properly. So we are going to pause now, and when I come back, I'm going to show you the clinic setup that we have. I'm going to do a procedure for you, and I'll see you in a moment. So I like to have a standalone tray set up specific for Onyfix applications. When your patients come in, it only takes 5 or 6 minutes to do the actual application, so it's very convenient if you decide at that time, after discussing with your patient, that this is an option for them, you can do the procedure immediately. You don't have to send them home and have them come back. Very convenient when you have everything all together. And for those of you who did attend the workshop, there is a PowerPoint slide that does list everything, so you can have this nice tray ready to go with everything that you need. So in the Onyfix starter kit, you are going to get the hard composite, you're going to get the soft composite, and you're going to get the Onyfix primer. In the Onylux toolkit that comes with your starter kit, you're going to get most of the things that you need to do the application. So you're going to get the spatula, and that's used for applying the hard composite. You're going to get your single-use cannulas, which are used for applying the soft composite, and you're going to get the LED light with a specific wavelength and power to properly harden the Onyfix resin. In addition to that, I've added to my tray burrs. If you remember, we do need a diamond burr and a ceramic burr. We also are going to need a nice portable drill. We need rubbing alcohol. We're going to need cotton swabs, 2x2s, a timer. This is just a little fantastic 30-second timer from Amazon. You will find you're going to struggle if you're trying to set the timer by your phone, and not all wall clocks are set just perfectly. And then, of course, you're going to want a mask and gloves. Other than that, you are ready to go for your application. So now I'm going to show you the 6 easy steps in the Onyfix application. As discussed earlier, the first step is going to be debriding the nail. So I'm taking my diamond burr and I'm just roughening up the nail. This allows the primer to create a better grip. If you have a very thin nail, don't debride too much, because if you remember from the workshop, thin nails tend to have more flap and don't hold the Onyfix quite as well. Thicker nails, feel free to debride away. Step 2, of course, we've just created some debris. Let's start with a clean playing field. I'm taking some rubbing alcohol and just clearing off the nail so I have a nice surface to work on. Give that a little dry. Step 3, I'm going to take my primer. Here's primer. You need so little primer. If you use too much, it's just wasteful. So you put one little drop in the cap. That's all you need. And then you just take your cotton swab. I prefer to have a double-ended cotton swab because I like to dry it off when I'm done with the primer. So here I go. And I don't know if you can see it. It just has a very slight yellow tinge, and that's all you need. I apply it to the entire nail. I do get into the sulci. I want to dry out any sort of um, residue or skin oil that might be present. And once that's applied, if you remember, we take our LED light and we apply it for 30 seconds. Now, I like to wrap my hand. It is a bright light, but if you remember, this light is not harsh enough to cause any sort of issues for yourself and your patient. You don't need to wear glasses. So while we're waiting for this 30 seconds, I do a couple of questions that tend to come up. For the ladies, ladies always ask when they have Onyfix applied, can they wear nail polish? And the answer to that is absolutely yes, they can use regular nail polish. They cannot use gel or shellac or any sort of polish that needs to be removed with a file, because obviously then you're going to file the Onyfix off. A regular polish that can be removed with acetone is absolutely fine. Now we are already at that 30 seconds, so that has been cured. I take the other end of my Q-tip and I just dry it off. There we go. And so now we're ready to apply. I'm going to apply the hard Onyfix first, show you how to do that. So the hard Onyfix has a turn cap. One turn takes out about 1 millimeter of product. I honestly tell people when they're getting started to take a little bit extra. You can always waste it on your blue pad if you need to, but when you get the Onyfix resin, you'll notice it's quite chilly where I am. It's more like a putty and a paste, and you need to warm it up with your spatula on the toe while making sure that you don't touch the skin and pick up any sort of oils. So I like taking just a little bit extra. There's nothing worse than when you get it all warmed and you get it perfectly placed and you realize you're missing just that extra little bit of product, and so you have to go back and start over again. So until you become more proficient, I would take about a turn and a half. You just slide it off like that. And you'll notice when I first put it on her toe, it almost comes off. It's a very hard putty at this moment. And really to prolong the life integrity of the product, you want to keep it in a cool space. Direct sunlight can cause it to break down earlier than you want it to. So keeping a little bit cool, it really doesn't take that much time to apply. You just work it in the middle of the nail. I don't try and put it into the strip right away. I want to wait until it's nice and moldable. Once it's very malleable, the strip comes easy. So we're just warming it up for now. As I said, in some of your clinics, it might not even be as chilly as where I am now, and the procedure will be even quicker. So you can see slowly it's just becoming easier to work with. And that's when I start shaping my strip. Remember, we're looking for that 2 millimeter wide by 2 millimeter high. And again, you can play with this putty for as long as you need to. If it's going to take you half an hour, take your half an hour until you actually apply the light. It's perfectly acceptable to just keep working with it. I don't know if many of you remember from the workshop, but when they did the clinical studies, they actually watched to see how long it took practitioners to do this procedure. And typically from start to finish, once they were proficient at it, was between 5 and 6 minutes. So it's a very easy add-on to your practice. See how I'm trying to get as close to the sulci as I can without touching. If you touch, the oils in the skin can cause the resin to break early. But we're facing a nice, even strip. If you can't get it perfect, that's absolutely fine. Remember, you still have your ceramic burr at the end. Here we go. Now, before I harden it, I want to take my Q-tip, and that looks just about right to me. So if you remember, we take our light and it's 60 seconds. Once this is cured, it's cured. You don't have to have any special considerations if they want to put socks on, polish on, they want to go swimming, put on high heels, you name it. Your patient can now go about their day as if they didn't just have a procedure that's going to help with the curvature of their nail. A little easier on their system than having the matrixectomy done. So we were talking about the LED light a little bit earlier, and it's a question that does come up quite often. It's really important that you know that it does not stimulate carcinogens. It does filter out the harmful UV rays, but doesn't concentrate them enough to cause eye damage. So again, neither you nor your patient needs to wear glasses. The nice thing about this light, though, is it does use a lithium battery that is good for about 300 hours. And really, that's a lot considering you only use it for about 1.5 minutes per patient. You can recharge the battery, but it's important to not overcharge it. You want to let the battery run dry and then charge it again for about an hour. They do say that the initial charge should be about 3 hours, but most of them start working immediately regardless of the charge. A couple of tips: if you're finding the resin isn't bonding properly or falls off before it grows out, chances are you've either used too much primer, have too thick or too thin an application, or perhaps you touch the skin and the oils in the skin have now broken the adhesion. And so that is a minute. This is now on rock solid. It's like a little strip of concrete that's not coming off. As I said, the patient can go about their day. Before they do that, though, I'm going to use my ceramic burr, and I'm going to make sure that I have a nice, smooth, professional finish. There's no point in having your patient leave if this isn't smooth. It might hook onto their sock or their sheets and end up ripping their toenail. So definitely don't want that. So make sure you just give it a nice, smooth finish. And that is how we apply the Onyfix Hard. Now what I'm going to do is get my lovely assistant to switch feet, and I'm going to show you how we use the Onyfix Soft. Now keep in mind, the Onyfix Soft is typically used on the smaller nails. The soft and the hard resin are the same. They're just different consistencies. We find that it's really hard when you have a small nail to use the hard Onyfix just because it needs to be worked at for a little while, and you really don't have the surface space on a small nail. So they make the Onyfix Soft more like a glue consistency for easier application for those smaller toes. I'm going to put it on the big toe today, and it'll take a little bit of doing because it's runny and it moves fast, but I think that you'll get a better visual if you see me putting it on the large toe. So again, same steps. Debride the nail. She has quite thin nails, so I'm not going to debride too much. Then we're going to use our rubbing alcohol. Start with a nice clean toe. Just dry that off. If you remember what our next step is, it's the primer. We're going to take 1 drop into the lid and 1 drop only. And with our Q-tip, we're going to apply. Remember, this dries out the nail, it dehydrates the nail and allows for better adherence. 30 seconds, if you recall, with our LED light to cure that. And again, cover up that light. It's very bright. And there we go. I'm going to take the other end of my Q-tip, dry it off just to be certain, and this is when I'm going to apply my soft product. Now, with the soft product, you are going to use single use. Please remember these are single use cannulas. So if you like the soft product, you are going to want to order more because you only get 6 in your starter pack. So as opposed to a twist like the hard, it's a push tube. Oop, there we go. What you want to do first is make sure that you prime your cannula, and it comes out quick. When it starts coming, it comes out quickly. It's really important for you to, at the end of your procedure, to pull back because otherwise you're wasting all of the product that's in that cannula. Okay, so we are ready for the application. Just give small, gentle pushes, and remember, typically you're going to be using this on your smaller toes, so you have more time when it starts to run. So it's on, and then I'm going to take my spatula. This doesn't need quite as much shaping because you've already applied it in a straight line, but you can just perfect it. Get it right as close as you can. All right, I'm going to harden that. Remember, we need 60 seconds for that. I would like to say something I found. I've done over 125 treatments. There are the occasional patient that for whatever reason the Onyfix hard strip doesn't want to stay on. Typically those are those younger, thinner nails that have a lot of flap to it. So it's almost like applying a concrete wall to a sandy base and it just moves too much. What I'm finding with those patients is putting on 2 applications of the soft, one on top of the other, is working quite well. As I said, it's the same product, just different consistencies. And so when you apply the 2 strips of the soft, it really is providing the same support that the hard would on the big toes. So that's just a little tip for you to try. And so if I were to do that, as soon as I took this light off, I wouldn't file or anything else. I simply put another strip right on top. I can do that for you for the sake of the video. That's 1 minute. Here we go. I'm just going to put another strip right on top of what I already did. Now you typically wouldn't need this for the smaller toes. It's just because the bigger toe tends to require a little more assistance. The involutions tend to be stronger. So here I go right over top. Again, 2 millimeters wide, 2 millimeters high, and 60-second curing. It would normally be at this point that I ask if there's any questions, but perhaps some elevator music instead. So there's been a lot of debate about with the Onyfix system whether you should sell it to your patients one strip at a time or whether you should be doing a package. And that really is up to you. I'm finding with most of my patients that are younger, it probably is taking about 3 or 4 strips in total to correct the involution. So you can adjust your pricing based on that and depending on where you're from. Another question that I frequently get is, does the nail re-involute once it's fixed? Now, in Canada, we only have been using it for a year, so I can't speak conclusively, but in Germany, they've been using it for well over 3 years, and what their studies are showing is that no, unless there's a biomechanical issue or your patients are doing things like wearing very tight fitting, improperly fitting footwear, the involution does not reoccur. So that's really encouraging to hear. And that is the 60 seconds. If you remember, the next step is going to be to smooth that out with our ceramic burr. And there we have it. Just clean it up here. So now you've seen the applications of soft and hard Onyfix. I'm now going to show you how easily Onyfix strips are removed. So if perhaps you get the strip on, it's hardened, and you're just not happy either with the placement or the size and thickness, and it's too big of an error to adjust with your ceramic burr, it's very easily done. So you can use your ceramic burr to file it down. A quicker and more efficient way is to take a set of splitters and just trim it off. It will come off nice and simple, just like that. Very easy. At that point, you can take your ceramic burr and just get off the last little residual pieces, clean up the nail nice, and you can start again. All done. So I hope this demonstration has shown you just how easy the Onyfix system is to apply. After over 125 applications, I have seen the results over and over again. Now, like anything, it might take a few practice applications for you to get used to it and really use it optimally, but I encourage you to stick with it. Your patients and your practice will both thank you.